ACS is located in Columbus, Ohio, has been serving the community since 1976. It was founded by Xu Chai-di, who is a PhD student who came from China to OSU. And then from 1976 to 1996, he helped the community with volunteers from his church. They initially started helping international students at OSU, and then with Korean war brides, followed by war brides and refugees from the Vietnam War. ACS's mission statement is to improve the well-being and quality of life of Asian Americans and Asian immigrant families in Ohio by providing social services and empowering individuals through education, training, and leadership. The vision statement is an empowered Asian community responding to the needs of world of equity and social justice. The services provided includes education with our ESL and computer literacy classes. Our after-school program is mostly Cambodian children. Senior outreach is for the Cambodian and Korean elderly, Chinese, Korean, Lao, Vietnamese, Filipino, Asian, Indian, Pakistani, Bangladesh, Malaysian, Taiwanese, and Thai. Our mini grant project is reaching the hard to reach community-based photo voice to increase tuberculosis education and awareness. We started out in January 23rd, 2021 with community health worker training and training of the photo voice process. The photo voice is a participatory research methodology where people can identify, represent, and enhance their community through a specific photographic technique. The photo voice outcomes are educational materials for the community and policy makers. The role of the community health worker is to complete the photo voice training and evaluation to recruit participants, each group of 6 to 8 latent TB positives and or family or friends to conduct participant orientation and ethics training. The participants take photos, submit photos and written narratives according to the protocol, and then they convene the participants in weekly virtual meetings to discuss these photos. They then prepare and lead presentations to the community members and policymakers. The TB screening has become part of the Hep B screening community events. ACS was awarded a mini grant to do Hep B screening during the COVID-19 pandemic. As part of this process, the blood for the quantiferin test was obtained at the same time as the Hep B screening test in these community health fairs. The goal then is community-based participatory research and photo voice. For quantiferin screening, the outcomes are the education, screening, and linkage to care of these LTBI positives. It is a community academic partnership between key collaborators from ACS and the Ohio State College of Medicine. And at OSU, we had Drs. Brunette and Wang. They bring their expertise in community-based participatory research, TB health systems, community health, and infectious diseases. Dr. Wang is an infectious disease physician, scientist, and professor of medicine at OSU. She serves as a medical director of Ben Franklin TB program and is also the TB medical consultant for the Ohio Department of Health and the CDC. Dr. Maria Burnett is an associate professor at the School of Health and Rehab Services at OSU and has used and adapted the CVPR approach and worked with the photo voice technique in Lima, Peru. She is still doing these groups virtually. Myself, I'm the interim executive director of ACS for the last 3 years. I've worked with hepatitis B education screening and linkage to care since 2006. I previously was a laboratory director for Mount Carmel Health Systems for 30 years. For the free clinic at OSU, I serve as the laboratory director for the CLIA accreditation of the free clinics. There's Wang and Brunette. They had seen the announcement of the mini grant. They were interested and they came to me having heard that AACS was involved in education screening and linkage to care for Hep B. I also had seen the announcement and was interested in doing something about this Asian health disparity, and that's how the partnership occurred. There is a disparity in the Asian-born community. Many Asians are skin test positive and had been infected in childhood. Therefore, many have latent TB and don't know what the implications are. TB is a leading cause of death from infectious disease globally. It is estimated that 1/4 of the world's population has latent TB infection. Without treatment, approximately 10% of individuals with LTBI will go on to develop active TB disease. The risk is higher in immunocompromised individuals and the elderly. The U.S. Preventive Service Task Force recommends screening of LTBI in individuals who are from countries with increased TB prevalence regardless of time in the U.S. And those communities that we worked with, they come from countries where the TB prevalence is high, quite high. This effort to treat those that are positive for quantiferin is an effort that I would like to support.